Something's not right with healthcare in the United States. It's way too expensive. The quality of care when you compare US populations to European countries is woeful. And this is on top of the fact that, as a primary care physician, I feel like I am smart. I'm certainly hardworking, have a good work ethic, and it's certainly not from lack of caring. The journey in my professional career for years has been to work on quality, to step up again and again, to try new things and new ways to deliver superb care to the patients that I serve. I've worked with practices from all over the country that have stepped up to learn the chronic care model, to learn model for improvement, to learn PDSAs, and all sorts of tools and techniques, trying ideas from inside of healthcare and other places that have succeeded, trying ideas from outside of healthcare to see would they apply, help us do a better job for the patients that we serve. Every year I see practices step up, throw extra effort into quality and doing the right thing. I've even worked on a national demonstration project with practices volunteering all over the country to deliver superb care in solo and small practices, to show that even solo and small practices are willing to step up and try this kind of stuff. And what just slays me is that all of our effort, all of the work that we do, struggles against systematic policy that makes it very hard to do the right thing. It's not from lack of effort. It's not from lack of caring. It's not from lack of intelligence that we have the results that we get in the US system. It's a systematic problem from the policies that we have that impede our ability to do the right thing. The policies have to change. If we're ever going to have a high-performing health system in the United States, we have to begin to emulate what we see in other countries that have high-performing health systems. We need to have effective primary care at its base. That's the core of every high-performing health system in the world. Effective primary care has basic features. It has primary care as the first point of access. People say, I can get care when I need it. People have a relationship with someone who knows them. That relationship spans time, so that the knowledge of that individual guides the care that they get. People who are in high-performing health systems say that the bulk of their needs are met in their primary care office. That when they need care outside the primary care office, it's well coordinated and they know who to turn to when they have problems and difficulties. That's not what we see in the United States, and yet we spend more than twice any other developed country on healthcare. We need to refocus our efforts. We need to change what we're doing. And we can't continue to have incremental approaches, and we certainly can't continue to support the status quo. The status quo is killing us. The status quo was untenable. I talk to doctors and on listservs from healthcare folks all over the country every day, and I hear the pain and anguish that they pour out when they describe the gulf that's between them and what they know they should be doing for their patients. They struggle mightily. They stretch every way they can. But when they do the right thing, when they stretch, they get punished for doing so. They get punished financially. They get heaps of extra uncompensated work piled on by companies that ask them to play Mother May I games about arcane trivia that divert attention away from the patients they serve to answer questions from clerks. This has got to stop. We know what we need to do in this country. We need health care for all, not just insurance for all. We need a measurement and quality system that can actually work in practices. It doesn't break our bank accounts or break our backs as we try to answer thousands of arcane, trivial questions. We need health information technology that actually does the work that policymakers are asking us to do. I hear the demands from Washington. I think health information technology holds out a wonderful promise, but then I go and look at the marketplace and I don't see the health information technology that does what we're being asked to do. And the technology that's out there has a price tag I can't even afford in practice. The gulf between what seem to be well-intended suggestions for policy improvement and what we actually experience in practice is exactly where we live. We and the front lines of primary care in practices across the United States live in that gulf. We need to add our voices together. We need to be heard by those who are making policy to help them understand policy that makes a real difference, real change. We can help them form policy that creates a supportive environment for effective primary care. Please join me and colleagues and patients from across the country in supporting SavingPrimaryCare.org as we collect our voices, as we focus on real change now for the health care that all Americans need. Thank you very much.